we have a lot of lost potential in our communities from mothers who are gone too soon, who cannot live to raise their children into adulthood. And so, while it's a human rights issue, it's also a reproductive justice issue. It is a feminist issue. I think that understanding our current medical model, how it operates, how we get here, I think is really critical to understand so that people can actually think about what it does look like to design solutions.
Latham, thank you so much for joining me today on the podcast. I'm so thrilled to have you. I've been following your work for many years, and I'm watching all the exciting things you're doing with a new space and a new training facility. Super excited to have you here. So thank you for doing this today with me.
Dr. Avanti, thank you for having me. So excited to be here.
Oh, I'm so thrilled to have you. And I'm really excited because I am so happy to have someone like you who is an expert in maternal healthcare, who is sort of leading the charge, working in the disparities in the community, in Black communities, Black and Brown communities, to help with the disparities in maternal health care. And I think it's such an important topic for us to talk about. And so we'll dive into all of that. But I'd love for you to start with sort of sharing with our listeners your journey and how you got to where you are with Mama Glow, a doula training, a space, all of the amazing things that you're doing. Tell us a little bit about that journey.
Yeah, thank you so much. So, I grew up in Oakland, California, and when I was young, my mother became pregnant with my sister. I was 4 years old at the time. I would be 5 when she was born. At the time, I watched my mother navigate pregnancy alongside my aunt and my great aunt, and all of them being due within a month of each other, March, April, and May. And my sister and I are born 5 years, 10 days apart. And so I really got to watch unfold this life cycle and experience that as a 4-year-old, you're about the height of bellies, right? So I was bumping into bellies everywhere I went. And I also just watched these incredible Black women really just in their fullness of their bodies and also moving through a process together in community. And my recollection of that experience was that it was very beautiful. It felt very supported, felt very empowered. And and also they were just witness. They had each other. They were sharing information, tools, and then also storytelling in front of us. And so we weren't really shut away. We were largely at the table or in the living room or in the kitchen when these stories were being passed on. And so I sort of, listened as a child and internalized a lot of what was shared. My cousin, who I had at the time, was maybe like 18 months older than me. We would take Cabbage Patch dolls, which are like a relic now. People don't know what they are, but we would take Cabbage Patch dolls and we would stuff them under our shirts and then pretend to deliver each other's babies. And so our dramatic play was even like mirroring the things that we saw in life. Um, those things would sort of become like the rudiments of what would lead me to this work. At the time my mom was pregnant, she also gave me tools for navigating anatomy. So I learned anatomy at an early age. I could describe pelvic anatomy, by the anatomic term. And so my mother was really keen on using proper language. So I understood the difference between a vagina and a vulva. I understood, what the pelvis was and pelvic floor, and just, could even uncover some of the muscles because I was using Grey's Anatomy coloring books as a child. And so these were things that kind of, imprinted on me early. My mother would always say that when we were at the grocery store, she was like 7 months pregnant, and someone comes up to us and says, "Oh, your mother has a baby in her tummy." I said, "No, my mother has a baby in her uterus and it's going to come out of her vagina." And so she's like, "Yeah, she's into these things." And so she kind of took that and would remind me that these were the things that kind of were the breadcrumbs and kind of these like rudiments that will become my work later in life at Mama Glow. And I took these kind of lessons, and I think that those things imprinted on me in a way that made me feel comfortable with my body. Body literacy was, I think, a big piece of my upbringing. especially growing up in a home where my mother was very liberated. Like we would come home, we wouldn't have to wear clothes in our house. It was just very free. And so I came to know my body in ways that I think were probably not as normal, you know, culturally. Like we were always covered up outside, obviously, but inside it was like we could be free. And so I just had a different orientation around the body and being embodied, right? Um, and so I learned these skills very early. That would sort of fast forward to color like my work with Mama Glow. Another thing I think that was also helpful and I think part of the path too was meeting a master herbalist when I was young. We used to go to the farmers market and collect herbal remedies from the people at the markets, and my mom would get these space creams, and then she would also get like our cough syrups and things like that, and different salves and stuff from this woman. And one day she was like, she can come up to the mountains and Larkspur and like learn about the plants. And so I learned really early to listen to plants and plant allies for when it was the right time to pick them. I learned to walk the trails and identify the medicine along the trails. And that was helpful for me as a person who was, navigating herbalism and through different pathways, African American herbalism, Western herbalism, and Native herbalism as a sort of foundational understanding of plant systems and botany, which I also studied in school, environmental sciences, and so these are things that all color how I show up in this space of looking at the reproductive life cycle, looking at birth, and really sort of the what's available to us in our bodies and how we should be experiencing this event, which I don't see as I don't see it as a medical event or even a pathology. We pathologize birth a lot. And so I really see birth as, a rite of passage. I see it as a sacred event. I see it as a spiritual experience. I also see it as an opportunity for us to connect with ancestral wisdom and then collect medicine along the way through the pregnancy and through the birth process. And so when we come on the other side, we have become transformed. And that's really what the ethos of Mama Glow is all about. It is about transformation, it's about dignity, it's about comfort and safety, it's about community, it's about village keeping, it's about knowledge sharing and wisdom embrace, right? And so all these things are part of like what we do, and it's embedded in the work, it's embedded in the teachings and the trainings, and it's also really like what I want to impart on everyone, that this is information that we should all know. Many of us know it but have locked it away, and so when I am teaching, it's really a facilitation of collective memory, of collective remembering, and what I call like really recollection of this knowledge that has not been transferred down in ways that it should be, and now we have the opportunity to reclaim it. And so this is what we do in our spaces, whether it's the doula training program, whether it's a program that we develop for nurses in CVS Aetna, whether it's the training the same training that I developed for people, the Namaglo Doula professional training program at Brown University, where I'm a professor of gender and sexuality studies, whether it's a childbirth ed program, whether it's a breastfeeding, an advocacy program, like whatever it is, like we're bringing this love and this intention and this different lens on this experience that is really about reproductive justice, that is also about restorative justice, and that's also about like a reverence for the people who laid foundational, who really put their bodies on the line for us to do this work, and also for us to be able to carry a torch forward, and chart a different course and design something different. And I'm
Mhm.
really committed to different design, right? Like when you talk about what's happening currently
Yeah.
for us as Mama Glow, we think of ourselves like really as culture shifting. And so much of what we're doing in this space is about transforming and alchemizing what's here and making something new. And so that's really what I feel like God put me on the planet to do. And so I'm just really trying to be obedient and just let spirit order my steps.
So much in what you said. Thank you for sharing that. It was really beautiful. So many things coming up for me because so much of what you described of your childhood of watching the women in your family sort of helping each other, supporting each other through this process. It's very much ingrained in my culture as well as a South Asian woman. And I really experienced it more when I was going through pregnancy because my parents immigrated here from India. And so I wasn't surrounded by lots of family members where I could experience it in that way, but I did experience it when I was going through pregnancy, when my younger sister was going through pregnancy, even though we're, in different cities, very much similar to your experience of having our mother around, our aunts around, our cousins around, friends around, really supporting us through the process and taking care of us, and how much that support really helped us, not only feel more confident in our bodies, in our skills, and our understanding of what it was to be a mother, but just going through the process. I think again, there's so much there. And so thank you for sharing. That brings up so many memories for me as we're talking. But I want to just back up a little bit and talk about sort of what you alluded to about, sort of the disparities that are going on right now, the challenges in maternal health care for especially Black women, but also brown women in the United States. I was doing a little research and reading, and I mean, the numbers are really frightening. Post pandemic, there are in study after study, it shows that, Black women experience the highest maternal mortality rates across all ethnic and racial groups. And it got worse after the COVID pandemic. Um, and there were some numbers here that I was reading. I'm just going to pull them up really fast. Is that Black women are 3 to 4 more times likely to experience all kinds of issues, including mortality during pregnancy and birth, which is problematic, And so let's talk about from your perspective. I mean, these are all studies I can read, but I really want to hear your perspective because you are in the field on the ground doing this work. What do you think are sort of some of the challenges that we're facing in maternal healthcare for Black women, for brown women, women of color? From your perspective, what do you think those challenges are?
Yeah, I mean, I think well, there's a couple things to look at. Uh, in the United States, this is the most dangerous place in the developed world to give birth.
Yes.
Um, we have a higher obstetrician ratio to midwifery ratio compared to other industrialized nations that have a higher midwifery to obstetrician ratio, which means that birth is perceived globally as non-threatening, as a non, emergent event, unless it is an emergency. And here we see it the opposite. We really do see, we do pathologize the process and see it as we need to rescue the baby from the body, right? And we see it
Mhm.
as the birthing person and this experience of birth being precarious and needing to be surveilled and needing to be monitored, and something could go wrong at any time is really the lens, right? And there's many
Mhm.
reasons for that. Obviously, clinically speaking, if you're inside of an institutional setting, there are protections in place for those institutions, right? And so through insurance, legally, people want to also protect themselves from liability. So the type of care you get is compromised by this false sense of safety that is designed to protect the institution. So the institutional goals and the goals of people who go to get care are not aligned, right? So my experience of wanting to have, wanting to maybe be birthing upright, or my experience of wanting to be moving around the room, or to be untethered or not monitored the whole time. Those are things that are going to come into question, because monitoring and surveillance is hallmark for all of our institutions, because when we look at medicine writ large, but really all institutionalized spaces that we occupy, um, all of them are carceral in nature. So there is already a thread and a through line um, of confinement, of surveillance, of mistrust, of power over, dominance, um, hazing. All of these elements like show up in these experiences that people talk about all the time, and talk about experiencing directly, um, through their care, whether it's through nurse practitioners, doctors, it could be staff members, but people experience harm that's associated with dismissiveness, um, not feeling listened to or heard, having rushed care. All these things like contribute to an experience where you don't feel safe, right? But then on top of that, you have people who are underdiagnosed or misdiagnosed. You have people who are seen as being, oh, you're complaining or nothing's wrong. So hypochondriac, right? Like seen as not being serious about their care, or seen as, oh, you just want drugs, right? So that's why you're here, not really because you're in pain. Um, Black women are often seen as being impervious to pain. And so the idea that they could be experiencing pain or have a higher pain tolerance than white women is a pervasive thought. And so you've all these things that you're like dealing with that are really uh, hallmarks of medical racism, and institutional bias that shows up for individuals along different intersections in um, in life, and how they show up embodied in spaces if they're racialized, right? Also, there's the real experience of medical neglect that occurs, where, you know, a decision is made that is life threatening or lethal. And this happens frequently. Uh, it happens frequently, and people do not have recourse to take action because, like policing, you know, medicine and hospitals like also protect, like they double down and protect their own, right? So nobody's gonna like push a doctor out there and say, but they stay in line. And so if you want to really see how people, what it looks like to pursue justice, and if you really want to see what it looks like to be harmed by someone who operates within one of these institutionalized spaces, you can compare whether it's a school, because there's unions, you can't fire teachers, whether it's policing, they get like maybe sent to a different county or something, they still can police. If you're a doctor, you can switch hospitals, you still can practice. There is no actual accountability. And we can see that, right? So for Black people who experience this harm as debilitating, as incapacitating, like it impacts what we perceive as our capacity to birth, right? To see that other people are dying or having near death experiences, that impacts our capacity building as birthing people. Um, it also causes a lot of stress and distress and anxiety to think about that as you're navigating a pregnancy. Um, and it also, as a real experience, does impact our um, our communities, because they are matrilineal in nature. And so our communities are designed with women at the crux. So when a mother dies, it does distort the community. It does distort the community. So we have a lot of lost potential in our communities from mothers who are gone too soon, who cannot live to raise their children into adulthood. And so while it's a human rights issue, it's also a reproductive justice issue. You know, it is a feminist issue. It's not the feminist agenda, right? But these are things that are really concerning. Um, I think that understanding, though, the rudiments of our current medical model, um, how it operates, how we get here, I think is really critical to understand so that people can actually uh, uncover and think about what it does look like to design solutions. Because most of what we're experiencing or sort of trying to understand is through this lens of like a singular event. Like, how did this thing happen?
Right.
Not actually, how do we design a system that
Mhm.
allows something like this to happen again, right?
Right.
So, what does it look like to redesign that actually centers the most marginalized? Because that's what's really important.
Mhm.
I like to think to like the disability justice work that is happening all the time because marginalized people always have the best solutions, because nothing is being designed with them in mind. And so when they were working on the Disability Act, one of the pieces was to figure out curb cutting and sidewalks, right? And nobody could understand how we would do that. Oh my god, infrastructurally, how would we do that? What a nightmare. Like how are we going to do this on every curb in the country? And it's
Mhm.
this huge thing. And if you're in a wheelchair, or if you're on crutches, or if you are in some way, shape, or form getting to the end of the street and cannot cross because there's not a curb dip in the sidewalk, it can impact your life in a big way, right?
Mhm.
Imagine what that
Right.
does. Like, we who can walk comfortably and can
Right.
move and have mobility, it's really a privilege. And so being able to walk and not think about walking off the end of the curb
Right.
is also something we don't have to ever, think
Sure.
about for now, right? Because we might
Mhm.
not be part of that community. But if you are if you are um you know in that community, that's a huge thing to have considered, right? That seems like not a
Mhm.
big deal, but what you realize is that when you do the curb cuts, do you know who else benefits? The child that's on a tricycle, the older woman
Mhm.
who's pushing her grocery cart across the
Right.
street, a woman who's pushing a stroller, right?
Mhm.
you know
Mhm.
a a little kid, trying to, or people who are taking the little kids like out to,
Right. To
walk, and
walk.
they, come off the curb, right? Someone with a puppy trying to cross the street. Everybody benefits, right? So
Right.
people who it makes all of our lives easier,
Mhm.
right? But it's designed for the people that it'd be
Right.
impossible for them to have ease in their lives. And so
Right.
we have to think about it from this perspective of designing for the most marginalized. And
Mhm.
so that's how we think about design. That's how we think about solution is what's actually going to make things better for Black women. Because when we do see the disparities for our community, we see the disparities there. So that's what we need to design. That's where we need to put our resources is making it better. It doesn't mean that we're only making it better for Black women. What it means
No,
is
of
that when
course.
we get it right for Black women, it's better for everybody,
Right.
right?
Right.
So this is what's important.
Yeah, and what's that springing up for me also is that it's sort of this idea of the root cause, which is what we do in integrative medicine, what we do in Ayurveda, right? We look for the root cause. It's not about just dealing with the symptom that shows up. So, like you said, the event, right? Oh, something bad happened during a birthing event at the hospital. Let's see what happened there. It's uncovering like what is the whole system? What is the root cause of what led up to that event happening? Right? There's so many other pieces that are involved is what you're talking about. And then it also and I think your point is a really, really important one, is that when you solve in that way, when you start to look for the root cause, the systems that are in place, you do make it better for everyone by focusing in on the people who are most marginalized. That is a benefit that ends up, spreading to everybody, but you're also doing the most important thing, which is helping the people who are at most risk, right? Which is, I think, what you were saying. So I think that that's really important. So let's talk about doula services. And I think that the first thing we should do is first educate people on what doula services are, and, what maybe midwifery is, because I know people have heard of midwives, have heard of doulas. They may not know the difference. So let's start with that. And then let's talk about, how doula services sort of start to become the solution that's helping with the root cause, to help with the most marginalized in the birthing world.
Yeah. So I think I could start with just level setting what a doula is versus a midwife, since there's
Sure.
confusion sometimes there. And I
Yes.
talk to a lot of people who don't know the difference. Even I talk to medical students that don't know the difference. And
Yeah.
so very important to help with community as we navigate, right? So a doula is a non-clinical care provider that provides emotional support, physical support, education, advocacy tools, partner support if you have a partner present, and really helps as like a cheerleader, as a my client calls a producer for your birth, right? Somebody who's really thinking about all the ways in which you need to be supported on that journey with you, as a companion and a trusted source, not only of information but a non-judgmental presence of support, right? So they're there to provide like the soft skills, the things that just make you feel good. The midwife is a clinical care provider that does everything from well care along the reproductive life course. They can deliver your baby. They can also provide abortion and loss support, as well as menopause support as you transition out of the reproductive life. Um, they are particularly skilled, obviously, at navigating the pelvis and understanding development of pregnancies without a high tech technology. They do integrate it, but they also are trained to be able to understand what's happening inside your body without it. And so they do diagnostic screenings. The midwifery model of care does center the birthing person and or family at the center. And so the model is more circular versus within a clinical model is more of a pyramid with a physician at the top and going down. So that model is, more aligned with autonomy and body sovereignty for the individual who's getting the services, and really, for someone who wants to have a different type of birthing experience. So if you want out of hospital birth, birth center, home birth, these are people who can attend in those environments. There are midwives who also work in hospital settings. They are also in those settings working within the confines of the institutional model, which means that there are constraints around how that care is delivered compared to care at the home level or birth center level. And so, how doulas midwives work together is that they work like they're like peanut butter and jelly. They work really well. I like peanut butter and honey, but they work really well together. They're almost like a team that uh, intuitively supports the client and their needs. The doula will go and make sure everything is ready so that when the midwife arrives, the work that they're doing is really focused on, like, the delivery, but also, taking notes, giving some time for the parents to rest. The doula will help the midwife, almost like an assistant, you know, and in a home setting or in a birth center setting. Um, and so they kind of work really well because they have the same philosophy around the birth, generally speaking, are they're typically aligned in that way. In some cases, a midwife might take on a doula role in a hospital setting if there's a transfer. So if you're in a home birth environment or a birth center, you have to transfer to the hospital for whatever reason, say like there's a perceived emergency. If you're transferring, then the physician or the attending who's going to see you will now assume the role of your care because now it's a high stakes situation. The midwife at that point transfers into the person who's now becoming your support, right? So you can have instances where a midwife will assume the role of a doula, but typically speaking, they are delivering your care as clinical professional. Yeah, so I think, the final thing I'll say about the difference between midwife and doula is that one of the things that I love is that they can work together and do work very well together. And midwives, typically in like a clinical setting, can also help us to maintain, I think, some of the desires and wishes that might be part of our birth preferences or birth plan, but also really are people who typically are aligned, right, with how you're
Hmm.
thinking about navigating the birth as well. And so
Sure.
um, there's a natural belief in capacity building around the body and your ability to labor, and really an understanding that our bodies are designed to do this, and so there's already that sort of ethos, right, that they carry with them. And
Right.
so it makes for like a better experience, right, where you just feel more supported. And so
Hmm.
what
Right.
doulas are doing in terms of services that's different
Right.
is when you're getting care from a midwife, it is like getting care from your clinician, right? So you are getting
Sure.
prenatal appointments, right? So all that stuff is happening just like it would with your doctor. On the doula
Hmm.
side, the support is sort of more around skill building, knowledge building, um, really about supporting you in organizational skills as you prepare for the baby. It is designing systems for you so that you're prepared on the other side. It is learning about like some of your areas of vulnerability, like, oh, I'm really not good at speaking up for myself, or I have trouble, like, talking to my parents about certain things. It's like challenging some of those things about ourselves, and like, making space to have better communication, better and stronger relationships, so that on the other side, we're
Hmm.
able to navigate this experience and feel really supported regardless of the outcome. It's
Right.
also preparing us for all outcomes, right? So ideally, people want a vaginal delivery. They want to have this blissful birth that they've like dreamt. And, for some people that happens. And for some
Right.
people, they have a different birth experience. It doesn't
Hmm.
have to be traumatic just because it's difficult,
Right.
right? Um, and so we want to make sure that also, regardless of what type of experience people have, that they do feel safety, they do feel
Sure.
dignified, that they do feel empowered on the other side of those experiences. And so doulas can help to anchor people in that safety, in that
Hmm.
dignity, in that connection, that belonging. They can help people feel prepared for whatever is going to happen. They can help people reorient around a scenario that's gone that different direction they hoped for. And they can also
Hmm.
help people process the labor experience. So a lot of what we're doing is around soft skills and
Sure.
really about emotional,
Hmm.
psychological, spiritual support, ritualizing, and creating a container of safety around the people who are navigating this process.
Right. Which is all so beautiful and so incredibly important, and harkens back to sort of what we were talking about in our own experiences growing up in our communities. Of that was the support we got from the other women in our family,
Yeah.
the friends, the community. That was that support. And so, how do you think that the role of a doula or the services of a doula help to improve maternal health outcomes for Black women, for women of color? How do you think that plays out in the outcomes
Yeah.
from
Well, we
your
have data.
experience?
Yeah, well, we have data. We do have a lot of data that shows the impact of doula support. So we have a reduction in cesarean sections, an increase in vaginal deliveries, a reduction in the use of pitocin augmentation. Um, we have a reduction in use of epidural. We have higher rates of breastfeeding and chest feeding, and more maternal satisfaction on the other side of birth. Yeah, less incidence of traumatic birth, right, or perceived traumatic birth. So, we have, and all of this is across the board, and obviously depending on like what demographic you're studying and over what period of time, those numbers will be different. But across the board, like that's what we see in terms of efficacy. And when we're thinking about just in general, my experience, and then also because I don't practice as a doula really anymore. I maybe do like one or two births a year. I've done hundreds of births, but really I'm an educator and a professor, so it's not something I can do anymore. But I will say that what we see in New York as Mama Glow Foundation is the largest provider of pro bono doula services in New York. And so we see tons of information that indicates that having a doula present along the pregnancy continuum, but also well into postpartum, is aligned with not only positive birth outcomes, but also, positive mental health on the other side. And so that's another thing that we're seeing too is that post COVID, a lot of people need also mental health support. Really important to ensure that people have community care models in place before their babies arrive and also have resources. And there are a lot of social services, available to people. It's hard to find them, honestly, but there are social services available to people. And we know that through our ability to provide pro bono doula services, there are people who would not necessarily have had access to doula support who now have it, and they have it for a protracted period of time, because typically if you were doing um, private hire for doulas, you would maybe get like two or three postnatal visits. And in this model that we have with the city, it's multiple visits, and so people spend so much time with their doula postpartum, which also
Mhm.
means that we can look for and screen for things like depression and anxiety.
Sure.
We can look out for signs of maladjustment that we wouldn't be able to do if the time was shorter, right? And so that's
Mhm.
another thing that's really beautiful about some of the programs that are also sprouting up is an attention to the idea that, like, it's not just a pregnancy we want to monitor, but postpartum is a
Right.
really critical period. It's important to be
Absolutely.
able to make sure people are supported.
Yeah, yeah. And so what do you think are some of the barriers to women actually accessing doula services? I mean, there's the cost, but then, what are some of the barriers that you see given that it's so effective in helping women across the pregnancy continuum and postpartum? What are some of the barriers that you're seeing?
Yeah, I mean, I think that, cost comes up for many people.
Mhm.
If you're doing out of pocket, if there's no insurance coverage, we're thankful to be involved in some insurance pilots and also helping to create doula benefits. So people can get the cost covered. But yeah, I mean, I think the biggest thing is cost for most people, a
Mhm.
lack of awareness. I think a lot of people
Sure.
understand what doulas are, but like I'm in a space where it's around me. So I don't know what that means. If I'm like in Kansas or if I'm in, I
Right.
don't know, some other place, like, is it common? So, and even if the concept is common, are there collectives? Are there
Right.
accessible doulas, right, in those spaces? So I think we still have maternity deserts in this country. So that does
For
mean
sure.
that even if there isn't awareness, doesn't mean that we have access, right? So,
Mhm.
I think that's one thing to address. But yeah, mostly, I would say that, yeah, we're in a situation where there's a lot of need
Mhm.
and there isn't a lot of practitioners available because, again, we're just now coming to a space in this country where doulas are on the federal agenda.
Right.
What it does mean is there's a lot of people who have these skills and have to be, and then they're trying to find a way to credentialize and then professionalize doulas.
Mhm.
And there's a lot of resistance to that because people have already been doing this work for so long. Like, how is the state going to say whether a training is, accessible or does make, it doesn't make sense to really like put more constraints and more paperwork on people who've been doing the work. But I think what does need to happen is finding a way to, pay for and also uh, commercialize, market, and make accessible the language, the services through various pathways, right? We know that people use their phones, so there should be ways to call and have someone on the line, to chat with somebody on text, to be with video calling with someone. and obviously these are privately available services, right? You can find these things on apps, but like the government, right, should develop like a platform where these things can happen, you know, or fund the people who are also developing these things to do them within the confines of their communities, right? Which is already happening in the private sector, right? So I think that, like, obviously, legislative and policy spaces take so long to catch up, and government takes so long to catch up. And so you do need to look to, industry where these things are happening. But yeah, the barriers for many people is like lack of awareness and then cost. But there are a lot of community-based doulas. So you can get pro bono doula service support. You can get sliding scale. There are people who will say, look, I can't do it because I'm not accessible or affordable, but this person can. And so there is that, but you do have to do the work. And I think a lot of people will, you know, they'll do the things like they're going to buy a car. They'll do all this research about a car or a house, or a vacation, and do all this research about the place they're going. And then when it comes to having a baby, it'll be like, well, like they won't take the time and energy to like interview doulas. It's like, are you serious? It's not that difficult to get on the phone with some people to figure out if you're aligned value wise. Right? There's information everywhere. One thing I would say is we have, a really cool guide called Birthing While Black that we developed in partnership with Carol's daughter. 60 pages of like relevant information that's like downloadable. And it's a guide that's for your phone, and you can just pull up information to navigate pregnancy. It's for anybody, but it was designed really with like marginalized folks in mind, particularly Black women in mind. And so I would say that that's a great thing to download from the Mom Glow Foundation website. We also have done a lot of incredible research on birth worker burnout. And one of the things that also makes doulas inaccessible is that they leave the workforce, right? And so burnout is also on the agenda for the Surgeon General. So this is like, a real issue across industries in the care space, right? And so we look at healthcare, we see nurses, we like 25% of nurses have left the workforce. So it is a huge problem in this country. So one thing to be thinking about, right, is what does it look like to also fortify the workforce? And so that's what we do at Mama Glow with caring for our doulas and making sure that they have access to supports to continue doing the work. We make sure that they're paid fairly, but then we also, make sure they have spaces to like process, what they're going through. As people who are navigating lived experiences, right, that are challenging. And so I would say, the report that we did was really, really important, and has been widely cited. It's called Birth Worker Burnout, and you can also go to the Mama Glow Foundation, to get that. But one of the things that we have to think about as we move forward is that, care is always like adaptive. And so it's really about, understanding the needs of the people who are saying what they need and designing around those needs, not designing what we want to design for them, asking how can we support you in the way you want to be supported, and then we make the design. What's happening now is we are designing this thing for you without your input, right? And so oftentimes it'll be, here's the meeting where we tell you how it's going to work, instead of here's the meeting where we discuss together and make a decision about how to move forward, right? That's not how we're operating. And so unfortunately, what happens is so many resources get poured into things that were not ever tested, consulted by, or with people who are marginalized and people who are affected by these, issues in mind. And so people are creating solutions that don't serve anybody. So I would also say it's important, if folks have interest or desire to enter the space, or are peripheral to the space, or just want to be helpful, that you don't have to go create anything new. You don't have to go and, try to, go fix the problem by yourself, or cut in front of people. All you have to do is find people in your community who are problem solving, and pour into them with resources. You might be a lawyer, you might be a graphic designer, you might be a publicist, you might be a business person, you might just be a really great volunteer, you might be somebody who, is off work right now, or who got, laid off or whatever, and you have some time, pour into the people who are already doing this work and bring your resources to support in your community to make birth safer. Because on a national level, there's work being done, but the real work happens inside of our communities where we can make tangible impact. And so I encourage people to figure out, like, what are the local institutions, birthing centers, midwives, and doulas on the ground where they're at, support them, you know, pay for somebody to go through doula training, invest in midwifery care, pay for some people to get midwifery care, donate to a midwifery fund, right? I would say also contact your local electeds. Make sure that you're connected to what's happening within the hospital system where you live, right? What are your electeds doing? What is maternal health? What kind of maternal health policies do they have or are they working on? Right? Make sure that you are part of those discussions because that is how we advocate whether or not we're pregnant. Like, I don't know if I'm going to have any more children. My son's 20. I don't know if I'm having more. That's not up to me, right? but but what I would say is I can still advocate. I can still do things to make birth better for other people. And so each of us can do that. And each of us has a responsibility to do that because we can't just put it on people who are pregnant alone. We can't just put it
Right.
on Black women and women of color alone. We
Right.
have to make this be an issue that impacts all of us and it's important to all of us.
Right. I
Yeah.
think everything that you said is so important. And what I'm thinking about, because I'm a physician is, the role of physicians. And so what message do you have for healthcare providers who are in this space and in improving inclusivity and sensitivity to the issues in maternal health care for Black women, for brown women? What would be some of your advice?
I love this question because I have the privilege of working with so many healthcare practitioners. And, through the NIH, we have a grant to work with Northwell Health where we train their nursing staff in our doula training. So they have doula competency, which I think is so important.
Mhm.
And we're doing a longitudinal study, and so that study will also like look at the program that I've developed, and also like how we can impact care within these institutional settings, right? Um, we're also doing work with Montefiore Medical Center, where we have a HRSA grant with them to look at the impact of doula support on populations impacted by trauma. And so we have to work together, right? What I see is important is really to be open minded and to like interrogate what comes up for us around the feelings that surface, because what I find is like first defensiveness, like, oh, that's not us, or that's like, I don't want to own that part of, you know, the medical story or the history, right? That's not me, right? But it's like, it's not about that. It's really about like, well, as an individual who's invested in and operating within a system, like, how can we look at how that system is functioning and see how we can do things differently or better? How can we improve on and actually expand upon our skill sets, right? So, if I went to medical school, there's a lot of things that I didn't learn, right? And that's okay. That's okay, right? Like, right? Everybody learn. There's a right. There's a kind of um. I mean, there's a ceiling to what you can learn inside of a time frame. Right? We understand. So, because of that, though, it means that ongoing education is important and continuing to improve on that education is important. And so that's why we develop CMEs, so that doctors can continue their education and CEUs for like different other care practitioners. We developed an amazing program for nurse care managers with Aetna CVS to train them and do a competency for CEUs. And it was 100% attended because they were getting that credit, but they gained something that they didn't know they were coming for. And so, what I would encourage is that if you are proximate to birthing individuals, pregnant people, people who are navigating high risk pregnancy, like wherever people are, go take some courses outside and that are not provided necessarily by your hospital or your institution, but like look into other spaces and go learn from people of marginalized identities, right? Like go learn from queer folk, go learn from Black folk, go learn from POC folk, right? Go learn from everybody so that you can uh, integrate a different perspective and bring softer skills, but also empathy into your work in ways that are necessary. Now, when I talk about empathy, like I don't want a surgeon, right, when they are, cutting me open to be empathizing. I want them to be right, like surgical. But before they cut me open, I want them to sit on my bed and I want them to just hold my wrist and rub the inside of my wrist and sit with me and look me in the eye and talk to me about the course of care. I want before a cesarean for people who are going to be in the OR to walk over and to sit and say, I know this is not what you wanted. And um and yet this is where we are. And I'd like to know, how can we make you feel comfortable in the room? There are some things that are in your control. What music do you want to have playing? Would you like to see the birth? Would you not? Would you like there are some things that we can do to make it more humane, right? So that I can feel dignified in the experience, right? Like these are ways in which we can improve the experience and put hospitality into hospitals, right? It's a way that we can also think about like how someone recalls the experience, because what doulas do is we're so invested in actually the memory of your experience. That's actually my job, is to think about how you will remember it, how you will recall it, and the story you will tell. And so I'm invested in that story. And I'm invested in how you tell that story. And if more physicians were invested in how someone tells a story of their experience, they would do care differently, right? So we have to think about care from this lens of an individual experience that is life altering, but it could also be life affirming. And so let's make it life affirming, and let's think about ways in which we can honor what's happening for everyone out in the world, but at the same time lean into lean into our own responsibility to continue to self develop, self improve, and bring in and harness these new skills so that we can do care differently, and that will change the culture of our medical spaces, right? Like that. So if individuals work together to do things differently, that actually shifts institutional culture. And that's what we would like to see, right? And I think that's possible, right? So I love working hand in hand with physicians. I love working hand in hand with nurses. I love working with staff around these goals, because I know that they're possible. Like we can do it differently. It's a choice. And so I would love to see, the advice that I would have would be to, invest in, like I said, marginalized education from marginalized people who are doing this work, that are able to come into your spaces to teach you, or you go into their spaces to be taught, and honoring that work, and then figuring out ways to like bring it in, right? So how can we bring this work in, not just taking like, oh, check, I took the anti-racist class, 2 hours, check, right? Not this, because we're talking about hundreds of years of framework that's embedded in our institutions. You're not undoing that in a 2-hour course. But what you can do is you can start to engage over time, reading, workshops, exercises, dialogue, right?
Mhm.
Podcasts, you're in one right now, right?
Right.
Like really using these tools that are available to you, and seeking the teachers, right? Seeking the work. We have an amazing training program. It's in
Mhm.
person, finally for the first time this year in April, but then it's also online and widely accessible. And so there isn't an excuse, right? If you want to do it, you can. And
Right.
if you want to do this for yourself, and I would also say, because a lot of us orient around, okay, I'm doing this for other people. No, do it for yourself. Do it for yourself, because when you do it for yourself, when you show up for yourself in this way, I'm going to dedicate this time to learn these things, it will spill out onto everyone. That's just like
Absolutely.
part of it, right? So that would be my sincere hope and my prayer, more than my advice. It would be my prayer that people do that work so that we can make things better, because we can't rely on like an institution itself to make this change, the
Right.
board, the investors, or even the lawyers and the
Right.
insurance. Like we have
Right.
to rely on individuals to say,
Mhm.
I can change this moment, this interaction, this
Mhm.
one. I
Right.
can make it better. And so that's what I would like to see. And I would like to see, more people being held accountable, and also more people feeling like they have the safety to bring practitioners to account when things happen that, um, should be spoken out about.
Mhm.
People have to feel safe to be able to say something and surface that information. And so I hope that we can also create what I would love, like in a dream world, would be a safety net also for people who are whistleblowing, right? So that we could
Mhm.
also make our institutions safer.
Yeah. So your point about, learning as much as you can, going to the people doing the work and learning from them, I think it's so important. It's important in every aspect of healthcare. I mean, it's important in the work I do. And I think that that again is where you are looking at the root cause, because when you're in there learning from people who are doing the work, who are in the most marginalized communities, you're learning about the issues that are present, about the root causes for the problems and that you are seeing in the delivery room, in the OR as a physician anyway, right? That's where you're learning that. You're not going to learn it by reading a book. You'll get some information, but you're really going to understand what the issues are, what the root causes are. Again, we're going back to sort of where we started this whole conversation, is really getting to the systems, to the things that are causing the problems, and not just looking at the one incident. That's important, of course, like you said, but it is important to look at the whole system, and where are all these issues coming from? Where are the outcomes that we're seeing coming from? Because it's not just from the one incident of the actual birth experience. Yes, it's embedded in that, but there's so many other factors that led up to that, right? So I think it's so important. And so I am actually going to commit on this podcast to actually coming to your training. I'm not in the OR or, birthing any babies or anything like that, as a profession, as a physician. But I do think it's important in the work that I do as well to really understand more. Even though I'm a South Asian woman, a brown woman, it's still important for me to understand the issues that you as a Black woman face, that, my sisters who are Latino, who are Native American, other people of color, queer folk. I need to understand that more. So I'm going to come to your training as well so that I can learn more from the people doing the work. So, um,
Us too. We look forward to
yes,
that.
absolutely. Absolutely. And I want to see your space, which brings me to my last question for you, which is, what is next for Mama Glow? Tell us about all of the things you're doing. And, for the listeners, we will link all of these resources in the show notes, as well as some of the resources and studies that Latham talked about. I'll make sure that we link those in the show notes so that it's easy for you guys to find that information. But tell us about Mama Glow and what's happening.
So Mama Glow is doing so much. We have our annual doula expo, which you can learn more about on doulaexpo.com, which is our amazing culture shifting sort of festival. It's like Coachella for birth workers and families. People should come check that out. We love that space. We have amazing brand partners like CVS Health and Nanit and Coterie and all these amazing companies that you can interact with, but also there's amazing content. And so come check that out with us. That's this spring. We also have upcoming childbirth education for professionals that want to kind of go back through that path and understand how to support people through childbirth ed, but then also to bring that work into their doula work or whatever work they're doing along the care continuum. Obviously, we have doula trainings coming in person and online, where we have also a restorative justice infant feeding program, which really is about bringing people of color to a training to learn skills, CLC skills, for lactation, primarily people who've been locked out of that work and the ability to do that work. So I'm excited about that. And then we have the soft space, which is a new amazing um, it's a wellness oasis and education space, and really like the home for all of our programming. And I'm just thankful because it's really a dream realized. And we were able to, you know, find this gorgeous space that has, a kitchen, a library, it has like a retail area, and it has this gorgeous sanctuary where we do our programming. And it's right in Williamsburg, Brooklyn. So it's one stop from on the L train and 1 block from the L train. So it's no excuses. You can get there really fast from Manhattan. And we're just grateful. It's a beautiful space, and it is really about, finding a way to create soft places for us to land, um,
Mhm.
especially because the world is so much about, moving fast and an accelerated pace. This is about slowing down and being in the posture of ease. Really, like, that's
Mhm.
our mantra, to like embrace
Yeah.
the energy of ease. And the soft space is all about that. And so it's available for life events, rentals, things like that too, which we have a lot of. A lot of people do retreats there.
Mhm.
And so it's a great place for that. But come visit us, come check out the programming. We would love to see everybody in person as
Yeah.
well. Just give you a hug.
Yeah. I will be there. I'm next time I'm in New York, I will definitely stop by. And I just have
Yes.
one last question. I know that we're at time, that I always end most of my interviews with, which is, if I offer up the phrase to catalyze healing, what
Mm.
comes up for you?
For me, catalyzing healing feels so good to say, because what comes up for me is leaning into ancestral wisdom, leaning into our capacity to heal and make whole. And I think it's about action. Healing is so amazing because part of it is just happening to us. But then there's also, I think when you talk about catalyzing, it's happening through us. It's like us
Mhm.
also being agents, and having agency in our healing. And so that's what comes up for me when you ask that. Yeah.
Latham, thank you so much. This has been an amazing time. I appreciate all of the amazing work that you're doing. I have so much respect for you. And I've learned so much. Thank you for educating me and for being so generous and loving in the way that you present things and talk about things. It's really, really wonderful. Thank you.
Appreciate you. Thank you so much for the invitation, Dr. Avanti. Appreciate you and can't wait to see you soon.
Yes, absolutely. Absolutely.